Hi everyone, welcome to our channel. Today we will be discussing an important medication called Pregabalin, often known by its brand name Lyrica. It's used for a variety of conditions including nerve pain, seizures, anxiety. Let's take a closer look at how it works, its benefits, side effects, and many more. So, what is pregabalin? Pregabalin is a medication primarily used to treat nerve-related pain, seizures, and anxiety. It belongs to a group of drugs called anticonvulsants, which means it helps reduce abnormal electrical activity in the brain. Indications. So, when is pregabalin prescribed? Let's talk about its main uses. Number one is neuropathic pain. This pain is often caused by damaged nerves, often seen in conditions like diabetes, spinal cord injury, or shingles. Number two is epilepsy. It's used as add-on treatment for people with partial seizures. Number third is fibromyalgia. This is a chronic condition that causes widespread pain and fatigue. Number four is generalized anxiety disorder. In some countries, pregabalin is used to help manage anxiety. Mechanism of action. Pregabalin works by calming down nerve activity. It binds to specific calcium channels in the nervous system, reducing the release of neurotransmitters that send pain and anxiety signals to the brain. Let's take a closer look at how pregabalin works. So this is the structure of a neuron. Okay, so this is the sending end, it's the receiving end, these are the dendrites, this is the axon. Okay, so this is the microscopic picture of this part of the neuron. Here these are the calcium gated channels, these are calcium ions, these are the vesicles, these are the neurotransmitters. Okay, so first we will discuss that how we experience pain. Okay, like if we are hit by something or we experience a bone fracture, so at that part of the body these neuron conducts the signal to the brain through the pathway of series of neuron. Then the brain processes these signal and we experience pain. So how this exactly works? Let's see. When we are hit by something, an axial potential is generated and this is travel through this part of the neuron to the other neuron. Okay, so how the signal travel to the other neuron? Okay, when action potential is generated, these calcium gated channels, these get open and there is influx of calcium ions into the neuron, and then these vesicles containing the neurotransmitters, these release the neurotransmitter to the binding site on the postsynaptic neuron. These are the binding sites and these neurotransmitter they bind to the receptor, and there is also generation of action potential in the postsynaptic neuron, and same phenomena is repeated, and in this way the signal conducted through the series of channels of neurons, and this signal is conducted to the brain and we experience pain. Okay, so pain are of different types of pain. The first one is nociceptor pain. This type of pain occurs when your body tissues and organs such as skin and muscle experience injury like arthritis or in bone fracture. In these conditions, special neurons in the affected areas passes the signal to the brain through the pain pathway, and these are usually time limited and may be controlled with the over the counter analgesic treatments. The other type of pain is neuropathic pain. Unlike pain which originates from the site of injury, neuropathic pain is caused by the neuron themselves. Certain diseases damage neurons, leaving them in a sensitized hyperstate, which causes pain even in the absence of original injury. These damaged neurons may continue to fire signals, and your brain processes these signals and you experience pain. Example of neuropathic pain is diabetic neuropathy, postherpetic neuralgia, and in these conditions, over-the-counter analgesic do not respond, so we can use pregabalin. So how pregabalin work in this condition? Okay, pregabalin binds to the alpha 2D subunit of the calcium gated channel. So when pregabalin binds to this subunit, it margins the influx of calcium ion. So fewer calcium ions will get into the neuron and there will be release of fewer neurotransmitter. Okay, when the fewer neurotransmitter will release and fewer action potential will be generated in the postsynaptic neuron, and in this way nerve signals become calmer and less frequent as pregabalin binds to the calcium channel. So this action helps reduce pain, prevent seizure, and even control anxiety symptoms. Dose and dosage. As you can see, different doses of pregabalin: 25 mg, 50 mg, 75 mg, 150 mg, and there is also 300 mg. Now let's talk about dosage. Pregabalin comes in different forms and doses. It's important to take it exactly as prescribed by your doctor. Here are some common dosages. Number 1 is neuropathic pain. Typically, doctor starts with 75 mg twice daily, and which can be increased on how you respond. Number 2 is fibromyalgia. Often the starting dose is 150 mg per day, which can be increased to a maximum dose of 450 mg per day. Seizures. You might start at 150 mg per day with adjustments as needed. For anxiety, the dose usually starts at 150 mg per day and which can be gradually increased. Pregabalin is taken once or twice a day with or without food. Just remember, never stop taking it suddenly without consulting your doctor. Contraindications. Pregabalin isn't for everyone. Here are a few key contraindications you should know about. Allergy. If you are allergic to pregabalin or any of its ingredients, you should not take it. Kidney problems. Pregabalin is cleared through the kidneys, so people with renal issues may need a lower dose. Pregnancy and breastfeeding. Pregabalin may harm a fetus or pass into the breast milk, so consult your doctor if you are pregnant or nursing. Side effects. Like any medication, pregabalin comes with potential side effects, but avoid alcohol and opioids while on pregabalin as they can increase side effects like drowsiness and respiratory depression. Here are some common ones that include dizziness and drowsiness, blurred vision, dry mouth, weight gain, swelling in the arms, hands, and feet. Special considerations. It should be used cautiously in older adults as they are at high risk of falls due to dizziness. Additionally, if you have a history of a drug or alcohol abuse, speak with your doctor before starting pregabalin.